Imagine for a moment that you've been receiving chemo treatments for months on end and are experiencing the typical side effects of such treatment. Your mouth and tongue are covered with painful sores and you have persistent nausea. If the cancer doesn't kill you, then you might die from pure starvation from not wanting to eat. The only thing that gives you enough relief to put just enough sustenance in your body is marijuana. Smoking or ingesting the main ingredient in marijuana, THC, is sometimes the only way that people with chronic health conditions can find relief, and I strongly believe medicinal marijuana should be legalized in all 50 states. THC in its natural form is more often than not the better option for those suffering from severe health conditions ranging from glaucoma to anxiety to many different cancers and chronic illnesses. When compared to pharmaceuticals designed for certain illnesses, THC has been proven to be more effective at eliminating symptoms of those illnesses. There are steps that you and I can take to put the wheels in motion to legalize THC in the United States for medicinal purposes. Many different pharmaceuticals today are either synthetic, which means they are made solely from chemicals in a lab, or they're semi-synthetic. They're a mixture of lab chemicals and natural elements from the environment. There's a drug that's been on the market for many years, Marinol, and its active ingredient, according to its website, marinol.com, is man-made dronabinol, which is also known as none other than THC. Marinol is prescribed to persons with AIDS to help with their loss of appetite and to persons suffering from nausea due to cancer chemotherapy treatments. Some of the adverse effects of Marinol include dizziness, abdominal pain, vomiting, and the list goes on. Right on the website, it urges caution when using this drug in the elderly, children, those with heart conditions. So why force a synthetic form of THC down an already ill person's throat that could possibly worsen their symptoms when they could just ingest it in its natural form? There are more than 60 active ingredients in marijuana known as cannabinoids, the primary one being THC. And according to the article Medical Marijuana, Benefits, Risks, and State Laws on livescience.com, our bodies naturally make cannabinoids to regulate pain. The article mentions similar side effects from smoking marijuana to those of Marinol, but remember, Marinol contains synthetic THC amongst other man-made chemicals that have the potential to cause more serious side effects. So, would you rather ingest a substance in its natural form with the possibility of lessened side effects, or ingest the synthetic form mixed with many other unknown chemicals? If I were in the position to choose, I would definitely choose option A. Now that the wheels are turning, what illnesses does THC help? There are many illnesses THC has been proven to help the symptoms of, and in some cases, it helps more than common pharmaceuticals for those illnesses. In the livescience.com article, Medical Marijuana, it mentions a study done to test the effects of using marijuana to relieve pain caused by damaged nerves in HIV patients. The study found that marijuana is in fact more effective at alleviating the neurological pain caused by HIV than morphine, which is typically the drug prescribed for these patients. As a healthcare professional, I have seen firsthand in my patients how it helps with certain conditions, such as controlling blood pressure to keeping anxiety at bay. The article also mentions the ability of marijuana to give HIV patients an appetite and to curb the nausea that cancer chemotherapy patients experience. It's no secret that smoking or ingesting marijuana can induce hunger. I'm sure you've all heard of someone having the munchies. If these patients had access to medicinal marijuana, they would be able to at least eat while battling their disease, providing yet another positive example for the case of medicinal marijuana. It's time to change the way we as Americans think about legalizing marijuana for medicinal purposes. Our very own Kentucky Governor, Matt Bevin, has made known his support to legalize marijuana due to the undeniable scientific evidence that it does help with certain medical conditions. According to MarijuanaPolicyProject.com, in 2016, legislation to legalize marijuana was introduced to the House and Senate in Kentucky. Unfortunately, the issue did not receive much, if any, attention, and the session ended without our legislators taking action. However, Senator Perry Clark from the city of Louisville is introducing a new bill for consideration in this year's legislative session. The bill Perry is introducing aims to form a medical marijuana program. If you visit marijuanapolicyproject.com, you yourself can and should make your voice heard by writing your legislators. It's as easy as following the hyperlink on the website. The other half of the battle is legalizing marijuana for medicinal purposes at the federal level. The Federal Drug Enforcement Agency has labeled marijuana as a Schedule I substance, meaning it has the potential for being highly addictive and no use for medical purposes. Don't let this discourage you from petitioning your state government. While the federal government frowns upon legalizing marijuana at the federal level, they do trust that individual states can form their own laws and regulations when choosing to legalize marijuana for medicinal purposes. It is time to step forward and make your voices heard to turn marijuana legislation into a prominent matter. Again, it's as simple as following the hyperlink on marijuanapolicyproject.com. Marijuana has been compared to synthetic pharmaceuticals, tested to show its positive effect on the symptoms caused by devastating illnesses, and there are simple steps we together can take to push legislation for medicinal marijuana in Kentucky. Again, as a healthcare professional that has witnessed firsthand the usefulness of marijuana for medicinal purposes, I fully support its legalization. I urge you to make your voice heard. If not for yourself, then think of a loved one that could one day be suffering from the side effects of a devastating illness.